technical challenges, as you can see, and then we started looking at therapy. So there's Allegra here trying different therapy. So I call her my little munchkin. And here, and I also am not really familiar with the technical terms, but for her to be able to sit on her own without any support, and just when she's 2, was huge. And you can see that she had nasal gastric tube. We and I'll talk about the arms as well. And that's her trying to use a spoon or a tool, staying on the walker frame, but it's very well supported. She also had profound hearing loss, so that we've managed to cure it. And lots of cute pictures that we put there. So this is kind of like the journey of what we've done, and her recovering from lots of near-death hospital admissions, and she survived it. And we're always continuously looking ways to improve her health. And just some of the surgery that we're doing. And here I just want you to see that how her hair has grown. So we'll also talk about that. And we also explored TheraSuit therapy and I'm based in Sydney, by the way. So we traveled to Adelaide for these therapies, and her learning to roll here. And she does with every therapy with a smile, by the way. So she's very determined girl who just really wants to do as much as possible. And we're not just all about therapy. We're still trying to, let her have some fun while she's doing it. And she, plays on the piano. She uses flashcards to communicate to us. Okay, you can stop here now. This is that's the part I wanted to show. Canoe, you can stop the video. Thank you for that. So that's a little bit of my daughter. And just to, I know it's an unusual way of kind of like introducing, but I just thought that at least shows the little girl that Canoe so warmly described her. So when Allegra was born, she had congenital heart defects, and she was quite small. And in hindsight, I think she had growth retardation. So when she was born, she was only 1.7 kilos. They waited till she was 2 kilos. At 5 weeks old, she had open heart surgery. They think, maybe because she's small. I mean, they didn't understand why she was having the problems that she did. But during the heart surgery, we think that she may have had a stroke, and which caused problematic in one side. And the first year, we just, she just wasn't achieving a milestone. They described her having global developmental delay. We didn't really have any diagnosis, but she was diagnosed also with profound hearing loss. She couldn't swallow. She had no muscle tone, and she had very challenging respiratory issues. And also, her brain didn't recognize that she had arms, so she didn't use her arms at all. Her arms were just only reactive, so she didn't know how to use her arms whatsoever, and she would only use her neck to avoid things rather than using her arms. And she had constant pneumonia, so she would get overwhelmed if she has allergies, get overwhelmed with colds. She would be on antibiotics once or twice a month with every hospital admission just because of her lung infections. And it wasn't until when she was 1, they did a brain MRI that they said that she doesn't have enough white matter in her brain. It's not until 3 that she got a diagnosis with cerebral palsy. So and a lot of the stuff, it was a case of problem solving. So when she was about 18 months old or 12 months old, she just wasn't tolerating her formula, her baby formula, and she would have 4 formula feeds, 1 water feed. And I noticed after a formula feed, she was very lethargic, very whingy, complaining. But when it came to the water feed, she was fine. And so what I started exploring is actually making food for her, blending it, and put it through her gastric tube. So she's fed by a peg tube through the stomach. And then we started noticing the improvement on her. And I had not a single doctor agreed with me. The hospital didn't want to agree with me, but as Kanuna, I can be quite stubborn and assertive and pushy in a nice way. And we just, just said, look, and negotiate with the dietitian and the pediatrician that they said, okay, you can do that. It wasn't until she had an incident, which I luckily took a video of her having a formula feed, and then she actually nearly died from that because she had a respiratory distress. And so what happened over the time, we've discovered that her food intolerances was causing a lot of the health issue, and we eliminated food, like it literally was, we work out what food we give her overnight. If she's very congested, we stopped some of those ingredients and just went through that process of elimination. And what we've discovered was that she was intolerant to dairy, to gluten, to legumes, grains, and essentially, I didn't know this until much later when I was trying to go on a diet to lose weight. I discovered that she was on a paleo diet. So the paleo diet helped her and helped her being a lot stronger. And you could see the improvement on her and overall, like even with the therapy. Then I was taught about essential oils, pharmaceutical grade essential oils, and just learning the doTERRA range. There are a couple of good brands, but I'm just going to talk about the doTERRA range, where instead of giving her antibiotics every time she had a cold, we would use essential oil to treat her for 5 days, and then use antibiotics if she just wasn't recovering. And so it reduced the antibiotics requirements by 80%. So 80% of the time we did antibiotics, and she was just getting better and better and better. And then we also started biohacking, by the way, using Protandim, which activates an antioxidant therapy, and that actually got her to that we saw like the essential oils with the lack of like reducing the medication. Her hair was growing. The biohacking, her hair was and skin and everything, it was getting thicker. And why I'm saying that's important, because that seems to be the basis that we saw her adaptation to the therapy. And so we, luckily in the early days, we found a therapist when she was around 1 year old, that they did more of the sensory integration, and they were focusing more on communication and the hearing. And their therapy actually, technically we cured her hearing impairment. She was diagnosed with profound hearing loss, and how she got cured wasn't because we did anything with her ears. It was the neurodevelopment of her understanding sounds, and she was just got so many challenges with the neuro side. And so same with the therapy for the vision. And I've learned that vestibular and vision is all the gateway to the brain. And I know you guys are obviously experts in this, but I'm just telling you from a parent's point of view what I've learned that really has helped her. Once we got that vision and the hearing component, laying the foundation of her health, all of this is like building the building blocks that we're seeing great development and faster results with her therapy. But the therapy that we had with the hearing, we only couldn't do it until she was 5 because the government paid until then, and after 5 they couldn't see her anymore. And that's when we saw the therapist in Adelaide, who then started saying that what we were doing was a little bit too advanced for her. We had to go down to the basic, which is what you saw with some of the pictures, with learning how to roll, just really, and also the vision and the vestibular therapy. And that has started to make a huge amount of difference. And he also introduced power plate. So we do, and we still do, the vibration therapy for the power plate. and till this day she still has it, and that has really improved her muscle tone. And then we progressed to the TheraSuit, which the intensive therapy. Oh, before I forget, when she was 18 months old, and I read the book about the brain that changes itself. So I was still exploring. Internet wasn't really helpful. And I found an OT clinic in the US in Alabama that did intensive therapy. And she went, it literally woke up her brain. Like she started using her arms, and where she would never move her arms, she started smiling, she started seeing things, recognizing things. And we think that even though we were there for the OT side, it literally like it almost turned on the lights in her brain, because up until then she just didn't move, didn't see, didn't respond, very, very little movement, and only gave us very little clues, which what the where we did the communication therapy helped us recognize that there is something inside her, but she was that physically disabled that these little movements kind of like help. And then from 4 years old, we were also introduced to do the water therapy. So it was great to see Phasia talking about it, because we just did it. We now have a spa. Actually, we did one in the bathtub. We would do, instead of as a parent, we didn't have, like, the lady from Bhutan. We didn't have a spa. We didn't have a pool. She would get sick all the time in the local school hydrotherapy. So we had to stop that because we didn't want her. She kept getting a cold. So we just did it in the bathtub. We just did in the bathtub. One of us, my husband, myself, would be in the bathtub with her as part of the washing, but we made that as her water therapy almost every night, until she got too big, and she's too big for our bathtub. Then we thought, okay, well, then we looked at installing a spa in our backyard so that we can control the environment for her not to get sick. But yeah, so we just tried everything. So just having it in the bathtub. When we go on a holiday, we make sure wherever we book has a bathtub, so that we could also do it during the holiday, and where there's a pool, that she loves pool, she loves water. So we incorporate that, with everything we do. And the same with the therapy. Like you saw the piano. The piano is actually therapy for her. We just put her in front of the piano, and then that's her exercise by herself. It gives us 20 minutes break to do what we want, and the cause and effect. And I'm seeing that she's actually experimenting with her arms and what she's doing. I don't know how much time I've got left, but I'm now going to come to the stage where we saw Kinesio. So we were doing all of this therapy, but what we found, even though she's got greater movement and she's getting stronger, she just had those knee contractures that's still problematic. And we've tried splinting, we've tried casting, we've tried massaging, and we measured the angle and just nothing would work, until the therapist in Adelaide said, well, I said, how do you do it? Like, what can I do? She said, well, I know this guy, and then introduced me to Canoe. And so we were messaging, and Canoe came to Australia, and the pictures that you saw from day one, and I was there and I'm a witness, is that from a girl who she's 10 years old actually, who had those knee contractures, nothing got it straightened. And you saw first session, her left leg was absolutely straight. Her right leg was also still problematic, but it was a lot straighter. And so, and he did that for the 5 days that he was here. And he also did the arm, because she's quite tight around the right side of the arm. And so he also relaxed that. There's actually an image. If you have, like you saw Allegra's Facebook account, you'll see an image of Allegra stretching both arms where she couldn't do, stretching it straight, and Canoe holding that. And so after he left, the legs didn't stay straight right away. Like it just, because I guess it's muscle memory and it goes back. But Canoe left us, and I had a carer with me. So Canoe left us with a home program. And we were just talking, it's been 5 months since he treated our daughter, and she is doing things. She's actually almost getting herself up. Her legs are so much straighter. The piano she used to, for years, only the left arm. And in the last 5 months, she is pushing herself and using her right arm that she's not done before. So I guess this is a journey that we know we're not going to stop. I still, give Canoe a hard time. It's like, what else can I do? Can we try this? Can we try that? Can we this equipment, that equipment? Because I'm always exploring therapies. I'm always exploring ways. And I can tell you that all along the way that we've tried, even called laser, a whole bunch of stuff, not a single doctor has told me that I should do it. Have all poo-pooed my ideas, who thinks I'm a crazy mother, even though I myself is a very much have my own reputation in business, and I consider myself as an educated. I am an educated woman, but because of myself, that I know what I'm talking about on the business side. But I just kind of like, you just try different things and you just adapt with what works. But what I've learned is the constant repetition. There was one time, like every time she gets sick, she regresses a little bit because we've done nothing. So it was important to get her healthy, get her not sick, so that we just continue the practice and the home. And like my husband works, I work, we have a carer that helps us. So I know the challenges, and I also know the guilt when we don't do it as parents, and we feel guilty when she misses out. So we find ways. Like I said, we put her at the piano. That's therapy for us. We're not doing anything, and we can hear what she's doing. So my I guess is that we have absolutely not a single experience in anything medical therapy or OT or something like that. But as parents, is trying to be innovative, trying to keep that practice, and trying to find the right team to help your child is what we found, because we had therapists who claimed they could do something, but then they use the mainstream technique. It just didn't work for her. It works for other kids. So it's always worth trying to see what's working. But I can just tell you that stuff that I know Canute is not about PISTM, but his stuff, what he works, as therapist, I highly recommend that you learn from him so that you can help the kids in your country or in your city, because we don't have enough in Australia. And if it wasn't for COVID, I probably would be flying to India as often as we could. But that's not practical either. It's quite disruptive for our daughter. So anyway, I hope that's enough, and I haven't gone over time.